Hello and welcome to PetConnections. I'm your host, Dr. Richard Goldstein. Hearing that your pet has diabetes can be devastating and overwhelming. Although diabetes is more common in older pets, it can also occur in younger pets as well. As with any disease, it is more manageable if detected early. Diabetic pets can live long and happy lives with treatment, monitoring, diet, and exercise. Today, we are very pleased to have Azi Chegini with her dog Spider to share Spider's journey with diabetes. Spider had diabetes when Azi adopted him 3 years ago at around the age of 2. Also with us today is Dr. Ruth MacPete, veterinarian at Bay Park Veterinary Clinic in San Diego, California. Later in the program, we'll also be joined by Brittney Cirone, who is a vet tech at the Center for Animal Referral and Emergency Services, CARES, in Langhorne, PA. Thank you for joining us here on PetConnections. So Dr. MacPete, people relate to diabetes as they relate to human diabetes, obviously, and people are very familiar with type 1 and type 2 or juvenile diabetes versus type 2 diabetes. What about diabetes in dogs? What type of diabetes typically do dogs get?
Well, dogs most typically get type 1 diabetes, so insulin-dependent diabetes, and that means that obviously they require insulin, that the body is failing to produce the hormone insulin. That's what we most commonly see with dogs.
And in your practice, which is, I understand, a busy and successful practice in San Diego, how commonly do you see diabetes?
We see diabetes actually more commonly than people think. In dogs, usually about 1 in 300 dogs will see diabetes. In cats, we're seeing it in about 1 in 200 cats.
We'll get to cats. Well, let's just focus on dogs just for a minute. So when people come in with a diabetic dog, what is the complaint and how do you achieve that diagnosis?
Well, a lot of times we'll pick it up off of screening. So that's one of the things too that I always recommend in older pets that we're doing screening blood work annually because of diseases like diabetes, because sometimes, as you know, the signs can be subtle or non-existent. When they come in with symptoms, some of the early signs that we see are increased thirst. We'll see that the animal is urinating more frequently. Maybe the dog has to go outside more commonly. They're whining to go out, or they're having accidents in the house. We'll also see that they have an increased appetite, despite the fact that they might actually not be gaining any weight, or in fact maybe losing weight.
Yeah, and it's interesting. Some people associate a good appetite with like good health, and
yes,
so they often they won't go to the vet because he's eating great.
Yep.
But in reality, they're eating more and they can't assimilate those calories, so they're actually losing weight despite a good appetite.
Yep, and sometimes they're lethargic, but again, one of the things that, and I know you know this, but it's why screening blood work is so important, is because sometimes people don't notice those symptoms, especially if they have multiple pets. They're not really sure who's drinking more water, why they're having to fill the bowl more, and so that's why those are so important.
Yeah, and actually when we do screening blood work, so we're talking about glucose, right?
Mm-hmm.
We get a glucose in the blood, and it's important that blood is kind of run right away, right?
Yeah, yeah. And again, with screening tests too, blood and urine. So in older pets, I'm recommending both. And like you said, we're looking for, in the diabetic pet, we're gonna see that they have elevated blood sugar levels, and then probably also glucose or sugar in their urine.
And so when you talk to owners about their aging pets, and you talk about what could happen to them, they're going to get maybe some arthritis or kidney disease and diabetes. What do you tell them to look for in terms of diabetes?
Well, I tell them that all these diseases are more prevalent as pets age, and I tell them to be on alert at home, looking for signs like we talked about: increased thirst, increased urination, and then I really recommend that people do screening blood work every year to sometimes every 6 months, depending on the age of the pet. Yeah. And then I also counsel people about the fact that diabetes is a manageable condition, because I think when I'm talking to people about diabetes or kidney disease or why we do these screening tests, a lot of owners question whether they want to do the blood work because they think, well, what am I going to do if my pet has diabetes or kidney disease? And so that's one of the things that I really try to stress, the fact that diabetes in pets, just like in humans, is a manageable condition, not a death sentence.
Yeah, I think that the message about just any change that the dog experiences, eating more, drinking more, eating less, drinking less, any change should prompt a visit to the vet. And then I completely agree with preventative medicine is all about screening, and screening blood work annually for younger dogs, and then maybe every 6 months for older dogs.